In this video, we're going to discuss the role of medication as it pertains to tinnitus management and how medication such as aspirin or other types of medications can influence or affect your tinnitus. Medications can play a role in tinnitus management for some people, but it's important to note that not everybody who experiences tinnitus will have to take medication, and not everybody who takes medication will see benefit to their tinnitus. If you're someone who's currently taking medications or considering taking medications, it's important to consult with a hearing healthcare professional first to ensure your safety and well-being, and to make sure that you're not interfering with any other underlying conditions. Although medications can play a role for some people with tinnitus management, not all medications react the same way, and not everybody will react the same way to different types of medications. Medication can be used in a variety of different ways to help manage tinnitus. Some of the ways that medications can help are the following. Medications that might help with underlying conditions, such as an ear infection, vascular issues, or maybe even something like Meniere's disease. These medications can be helped to treat those underlying conditions, which may in turn have an effect on your tinnitus perception. Another use of medications could be for stress and anxiety. Stress and anxiety are common symptoms for people who are struggling with tinnitus. Therefore, anti-anxiety medication or antidepressant medication in more severe cases of tinnitus might be prescribed to help. Sleep aids, medications that can promote better sleep quality, can sometimes be used, as poor sleep quality is something often described by many people who struggle with tinnitus. Vascular issues or blood flow issues. For some people, they might be prescribed medications that can help promote better blood flow, which in turn, for some people, can help with their tinnitus perception as well. Another area where a prescription might come into play is if you experience hearing loss. Although this is not a prescription for a medication, this could be a prescription for a hearing aid to help improve your ability to hear and communicate, which for many people can also help relieve them of their tinnitus to some degree. Herbal supplements do not have a lot of evidence supporting the benefit they provide for tinnitus, but there are some anecdotal stories and there is some loose evidence that suggests a variety of different types of supplements or herbal remedies have helped people with tinnitus. Before taking any supplements or herbal remedies, be sure to consult with a hearing healthcare professional or your doctor to ensure your safety. Also, things like sodium, alcohol, nicotine can also play a role in your tinnitus perception. As you're taking some of these foods and beverages, monitor if they affect your tinnitus, and if they do, keep a log about how things like sodium and alcohol can affect your tinnitus, and you can share this with a hearing healthcare professional or a licensed dietitian who can help you make better choices to help mitigate the tinnitus that you're experiencing. Lastly, one of the more popular medications, something like aspirin. Many of us use aspirin to help reduce fevers with inflammation and pain. But there are many reports of taking a high dosage of aspirin that can actually exacerbate and make tinnitus perception worse. If you're someone currently on aspirin, talk to a hearing healthcare professional or your doctor to see if aspirin might be influencing your tinnitus perception. If you're someone taking medications or considering taking medications, there are some important things to consider. For example, individual variants. As we said earlier, medications can differ from other types of medications, and not all medications will be able to help manage tinnitus. And how each person reacts to the medications will be unique from person to person. Keep in mind any side effects that can be caused by the medications you're taking. And lastly, keep in mind the dosage that you're taking. Be sure to follow the correct doses to make sure that you're not taking in too much of a medication, which in turn can not only exacerbate your tinnitus, but can also have harmful effects on your health. Although some medications can help manage tinnitus, they are not a universal solution and they do not provide a cure. Be sure to get some expert guidance and follow up with a healthcare professional before taking any medications, supplements, or herbal remedies to ensure your safety and well-being. How can MindEar help you manage your tinnitus? Although MindEar doesn't prescribe medications, MindEar does offer you a variety of tools to help you manage your tinnitus on a day-to-day basis. This includes a sound library that allows you to choose from a variety of soundscapes to use as sound therapy to help distract you from your tinnitus. In addition, there's an educational catalog that provides a variety of different activities and exercises, such as deep breathing exercises, mindfulness, and meditation exercises that can help you manage your tinnitus as well as the stress and anxiety you may experience. Wherever you are in your journey, MindEar is here to help.